A lot of doctors that I train ask me if I consistently put the little marks with eyebrow pencil on when I'm actually doing the injections myself. And the answer is no. I almost never make the marks prior to my injection, but there are a couple of exceptions to that rule. And one is when I'm doing forehead, it's very easy if you go right into the forehead and you're trying to do all these injections and you're standing on one side of the patient because you can't be sitting on her lap. So if you're just standing on one side of her, then it's just, you're not going to be able to tell where the center is and where each left and right is. So when I'm doing the forehead, I like to mark with an eyebrow pencil ahead of time to make sure that I get it flat and even. And then it's easier for me to run across the forehead and do my intradermal injection. When I've just taught a doctor how to do this, I advise them to mark with eyebrow pencil every single time they do their injections. And there's a really good reason for that. And that is, you need to take your pictures without dots, with dots. 2 weeks later, when the patient comes back, you've used the dots, you've marked where you're going to do the injections, you've put in your chart how much you're putting in each injection. So now at the 2-week mark, you can go back and look at exactly where you put the shots and exactly what the result is. So ideally what you want to do as a trainee is take your pictures on the day one. On the first day she sees you, take all your pictures with and without dots on. And then when she comes back the second time, get those pictures out and compare them to how she looks now. And that is how you will do your own quality control, and you'll continue to learn exactly what the effects of Botox were, not only for that client in particular, but for your own learning curves gets better and better as long as you know exactly what you did the first time and this is the result that you got. If, for instance, there's an issue with a Spock eye coming up, then you'll look in and think, wow, you know, if I had known that ahead of time, then maybe there was something in that first visit that would have twigged me to the idea that she's going to get a Spock eye. So you start to develop that mindset about how to do things preventatively to avoid problems.
You done?